My name is Bree, and I am doing a video journal of my process going into spinal surgery. There are a few of these on the internet, and I find them immensely helpful, but there aren't really any that cover my specific situation. I'm having an ALIF, I guess they call it, and an artificial disc replacement. The fusion part will happen for my L5S1 disc, and the Prodisc-L prosthetic will be placed in my L4, L5 disc space. So, I suppose I should give you a little patient history. Let's see. Oh, also, I have notes because I ramble. Okay, so it's happening in less than 2 weeks. It's 2 weeks from yesterday, actually. And Dr. Michael Kropf of Cedars-Sinai is doing the spinal surgery, and Dr. Wagner is going to be the vascular surgeon who will be working on me. Alright, so patient history stuff. Sorry, I can't sit up, so this is probably going to be an awkward angle. Okay, I fell when I was 16, bouldering in Joshua Tree with a bunch of friends, and you know, they checked my arms and legs and said, yay, at least you didn't break anything. When I looked back up, you know, when I was standing on top, it looked like I was standing kind of like on the roof line of a 2-story house before I fell off the rocks. We were at Jumbo Rocks. After I got, you know, knocked out, fell, all that good stuff, and I looked back up, it looked, I don't know, like I was 16 and I don't have great, you know, depth measurement, spatial rotational ability, anyway. But I thought, it's got to be like at least 15 feet. The day after I fell, the dad type dude that was there, kind of like help us out, the Eagle Scout dude, said I was 30 feet. So I don't know, somewhere between 15 and 30 feet is when I fell. And I landed on rocks. I was knocked out on the way down, which probably helped to keep my injuries minimal because I landed limp. I was knocked back into consciousness, I guess, when I hit, and everything whooshed out of me, and I was like, I'm dead, that's cool. But, you know, I wasn't. Thank goodness, because that would have been kind of lame. So, nobody really, when I got home, nobody made a big deal out of it on the trip. I mean, they checked my arms and legs, said I didn't break anything, had me hobble back to camp, treated my hands and arms, because I tried to grab a rock before I got knocked out on my way down, and jacked up my arms and ripped off my fingernails and stuff like that. I had a big old goose egg on the back of my head, I guess from where I hit falling, and a big old, like, volleyball-sized black bruise on my booty. So, yeah, so, between my dad he just, was between jobs and didn't have any medical insurance, and, you know, nobody really believing me anyway. I didn't get any x-rays or medical treatment or anything for quite some time. I didn't have any decent x-rays until probably 5 years later, and then another good one about 8 years after the initial incident that showed that I had sustained compression fractures, the biggest one to L1 and then a smaller one to T11. So I'd broken my back. There hasn't been a day since that fall that I haven't hurt real bad every day. My pain averages between a 4 and a 6 on the pain scale. My pain scale, I guess, like if you go by the smiley face, frowny face pain scale, like I look at that in terms of what I can hide and what I can't hide of my pain. And I can hide, I can just go and I can dissociate from my body pretty much anything up to a level 6. After level 6, at a level 7, like I'm very aware of the pain. I mean, I've been aware of the other pain, but it's sort of like, I don't know, like repressed memories, I guess, only it's like ongoing. So, like 1 minute to the next, I'm not thinking that, you know, a minute ago I was hurting too. I'm just thinking, wow, it sucks right now. But like if you were to ask me, you know, have you always hurt like this since the fall? I'd be thinking, no, it hasn't always been so bad until I remember something. Because it's like there's like, I don't know, I'm rambling again. 2 parallel streams of consciousness, sort of. There's like the pain side and the like normal consciousness side. And until something happens that unavoidably merges the two, like like, for some reason I am extra hurty and it involves other people so I can't deny it or something, then I'll remember it. So I can have those, like, bookmarkers going back all the way to the actual accident. I have, like, bookmarks. And in my memories, I can remember those times, and I remember that it's not that unusual. So by that, I connect the dots, and yeah, it really hasn't ever stopped. Let's see. So, over the years, I've done chiropractic because I had congenital scoliosis anyway. I was born with scoliosis. Not a huge curve, but like an S. Physical therapy, I've been very physically active. I started dancing when I was 2. Ballet. Got into hula dancing when I was 5. Bunch of girls my age. That was super fun. Loved it. Kept doing that. Then I got into the jazz tap ballet thing and hip hop. When I went to university, I got into ballroom dancing, especially Latin. I have a trophy and everything. Super cool. I was on the ballroom team, like the backup team. Because, yeah, there were like 500 teams at my school. Let's see. But, oh, and I'm currently a certified Zumba instructor. Not that I've been able to teach for about the last 5, 6 months, 4, I don't know, somewhere between 4 and 6 months. Like I said, there's a lot of time warpage in my brain. Okay, so I've used diet. I know that white food, like white flour, white sugar, increases my inflammation and makes things hurt way worse.